Hello guys, today I'm here with another new topic which is a challenging topic and a sure shot topic. It is sure shot as it is asked in almost every exam. It was also tested in recently in your INI May. So it was recently tested in your INI May 2025 and it is almost tested in almost every exam. So this is a very important topic. So today we are going to talk about Rickettsia. Now this topic is challenging in itself because it has a lots of things to remember and also gets a little confusing with all the data that is there. So we'll start. So first there are 8 important ones that we have to remember. Starting with epidemic typhus, endemic typhus, then Rocky Mountain spotted fever, then Mediterranean spotted fever, then rickettsial pox, scrub typhus, Q fever, and trench fever. These 8 are the most important ones that we have to remember here. So we have to remember the vectors and the causative agent of all of these. Now the vector for epidemic is Louse. Now the Louse, we can remember it as Louse is a very provocative and a notorious agent. So Louse is a provocative and notorious, so it spreads really fast like an epidemic, so it causes epidemic. Then after treatment it trenches down and then it relapses. So Louse is a vector for epidemic typhus, trench fever, and relapsing fever. Okay, for endemic typhus we can remember it as flint. So endemic, flint. Flint के लिए for F we can remember that the vector is flea and the causative agent is Rickettsial typhi. Here the causative agent for epidemic typhus is Rickettsia prowazekii. Okay, since Louse is a very provocative agent, we can remember it as prowazekii. Then Rocky Mountain spotted fever. Rocky Mountain spotted fever, the causative agent is R for R, Rickettsia, rickettsii. Then your Mediterranean spotted fever, we can remember it as BMI. So I is for Indian tick typhus. I is for Indian tick typhus. And B is for Bhutanese fever. And M is for Mediterranean spotted fever. Okay, then rickettsial pox. For scrub typhus, we can remember it as S for S. Causative agent is Orientia tsutsugamushi. So tsutsugamushi. The way it is like spelled when we write the T that is there. So T is for trombiculate mite, which is the vector. Okay, so for scrub typhus, T is for trombiculate mite, which is the vector, and it is pronounced as S. So S for S, scrub typhus. Then for your trench fever, I told it here कि trench fever के लिए भी the vector is louse. Okay, so both for trench fever and epidemic typhus and relapsing fever, the vector is louse. Now wherever your vector is louse, human is the reservoir. Humans are the reservoir. Here also the humans are your reservoir in trench fever. Then for Mediterranean spotted fever and Rocky Mountain spotted fever, both of these we have tick as the vector. Tick is the vector for both of these. So you can remember it as tick is spotted. Tick spotted. Okay, so this is tick is common vector for both of them. Then I told you we can learn it by mnemonic BMI. Okay, so this is Bhutanese fever, that is Mediterranean spotted fever, and this is for Indian tick typhus. So for Indian tick typhus, the name itself has tick. So tick is the vector for Indian tick typhus. And the causative agent for Indian tick typhus is Rickettsia conori. Okay, so this is the causative agent for Indian tick typhus. Then your scrub typhus, I told you S for S. So it is caused by tsutsugamushi, which is very easy to remember. Most of us remember this most of the time because of this like different kind of a name. So then just put a T, which is actually there. So T is for T, trombiculate mite is the vector. And to be more specific, it is the larval form. Now the larva is also known as chiggers. So since the chiggers is a vector for it, it is also known as chiggerosis. So scrub typhus is also known as chiggerosis because of the chiggers larva. Okay. Then your Q fever. Okay, coming to the Q fever. So Q fever is the one which doesn't have any vector. So we can remember it as Q for question mark. Question mark मतलब कि vector का है. So it has no vector and also no rash. So there is two no's here. No vector and no rash. You can remember it as two no's. कहाँ है? Question mark. So no. Then the causative agent is Coxiella burnetii. We know that the causative agent is Coxiella burnetii. So instead of C, we can write its spelling as Q. So Coxiella burnetii is the causative agent of Q fever. Then trench fever. For trench fever, I told you guys that Louse is a very provocative and notorious agent. It trenches after treatment and relapses. So for trench fever, your vector is Louse itself, and it is caused by Bartonella quintana. Now Bartonella quintana is the only one that is cultured artificially. It is artificially cultured, that is why it is no longer included in Rickettsial family. Okay. Then your Indian tick typhus. We remember in Indian tick typhus as BMI, Bhutanese fever, Mediterranean spotted fever, and Indian tick typhus. So tick itself has its name. That tick is the vector here. Now tell me one thing, guys. What is murine typhus? Okay, what is murine typhus? Now, murine typhus, endemic typhus is also known as murine typhus. How you can remember it is कि endemic में आता है EN, here also EN, so you can remember it like this कि murine for endemic. Okay, so the mnemonic here was flint. So flea is your vector here, and for murine typhus, M for M, it is caused by Rickettsia museri, and it gives positive Neal-Moser reaction. Gives positive Neal-Moser reaction. Okay, so it is giving positive Neal-Moser reaction. Murine typhus. Okay, then coming to a quick recap of epidemic typhus. I told you epidemic typhus vector is Louse, caused by Rickettsia prowazekii. So it is a causative agent of the disease Brill-Zinsser disease. Now, what causes Brill-Zinsser disease is this Rickettsia prowazekii, the only Rickettsia which has Z in its spelling is prowazekii, so Brill-Zinsser disease. Then many times you are also given in the question the history of jail. So whenever there is some history of jail or any war, okay, something like that given in the question stem, your answer would be epidemic typhus because of the unhygienic conditions. Louse is involved in unhygienic conditions, so it causes epidemic typhus. Okay, so there your answer would be epidemic typhus. Now, it also gives Weil Felix test, your Rickettsia family. So this is also a question asked to you many times कि Weil Felix test में if it is OXK positive, then it is, you can for scrub typhus. Now how you can remember it is K for K, scrub को ऐसे लिख दो, use K in its spelling instead of C. So K for K would be scrub typhus OXK positive. Now the most severe disease of all of these is Rocky Mountain spotted fever. The most severe of all of them is Rocky Mountain spotted fever. You can remember it by when we climb a mountain. It is very difficult to climb a mountain on an inclined plane. So since it is very difficult, so it is Rocky Mountain spotted fever. Also, we use our hands and feet to climb on the mountain. So hands and feet comes together on the surface first. So hand and feet. So in hand and feet, your rash is involved. So it's a centripetal rash. So it's a centripetal rash, which is in contrast to what happens in epidemic typhus. So what happens in epidemic typhus? Epidemic typhus में palms and soles are spared. Palms and soles spared. So in your Rocky Mountain spotted fever involves your palms and sole, and we can remember it as R for R, wrist and ankle. Wrist is pronounced as wrist. R is there in its pronunciation, so we can remember it as Rocky Mountain spotted fever. R for R, wrist and ankle is involved, and it's a type of centripetal rash. in contrast to epidemic typhus, which is a centrifugal rash. Now a quick recap of all of these. Epidemic typhus vector is Louse, caused by Rickettsia prowazekii. Then endemic, Flint is the mnemonic, flea is the vector, and it's caused by Rickettsia typhi. Then your Rocky Mountain spotted fever. Tick. Tick is spotted. So Rickettsii is the causative organism. R for R is how we remember it. Then your Mediterranean spotted fever, we use the mnemonic BMI, Bhutanese and Indian tick typhus. Now Indian tick typhus is caused by Rickettsia conuri. It is caused by Rickettsia conuri. Then your scrub typhus, which gives OXK positive and caused by mite, trombiculid mite, tsutsugamushi. Then your rickettsial pox. Now your pox was left, so pox causes akal, so it is caused by Rickettsia akari is how you can remember it. That pox causes akal, it is caused by Rickettsia akari. And we can also remember it with the mnemonic PSM. PSM is a mnemonic to remember the vectors for the diseases which has mite as vector. So mite, M for mite, and rickettsial pox and scrub typhus, which is the trombiculid mite, is the vector for these. Now guys, I want to be very specific here that solving questions after completing any topic is very, very important. Very, very important, and don't consider any topic completed if your question practice and your PYQ practice is not done yet. Okay, so we are going to solve some questions here for you. So let's do it, and it would be solved by all the things that we have learned here. Now I'll also be telling here all the tricks that can be used to solve the question. We'll use the information that we have already. I'm very cool with that, but I'm also telling you to how to rule out options so that you come to the answer very quickly. Okay, so all those things we are going to discuss here. Now the first question that we have here is Weil Felix test is positive in OX19. Okay, but not OX2 or OXK. तो OXK वाला is तो very easy. ठीक है, all of us know कि OXK is for scrub typhus. तो OXK तो यहाँ पे नहीं है, तो scrub typhus can be very easily ruled out. Now OX2 भी नहीं है, तो OX2 के लिए we can rule out this Rocky Mountain spotted fever और endemic typhus में OX2 होता है. Okay, Rocky Mountain spotted fever and endemic typhus. So the answer here would be OX19 for epidemic typhus. This is your answer here. Now all are true about Rickettsia except Rickettsia. We know that Rickettsia are obligate intracellular organisms. They are transmitted by arthropod vectors. We saw various vectors there, Louse and tick and mite, all those are arthropod vectors. So yes, and vasculitis is caused by rickettsial organisms. They are pathognomic. Okay, so now we are left with option C. grow on artificial culture media? No, they are the obligate intracellular organisms, so they can only grow in cell culture or yolk sac. Only grow in cell culture or yolk sac is how they grow. So here C would be your answer. Then vector of epidemic typhus. We remembered epidemic as Louse is a very provocative and notorious agent, so it causes epidemic, then it trenches, then it causes relapse. Okay, this is how we remembered Louse. So Louse would be the answer here. Flea is for endemic. We remembered it as flint, so flea is for endemic. Then mite killing, we remembered it as tsutsugamushi. So scrub typhus के लिए mite होगा. T लगा दिया तो trombiculate mite is what we remembered. Then we also remembered the mnemonic for mite, which was PSM. M for mite, which is the vector for rickettsial pox and scrub typhus. Rickettsial pox and S for scrub typhus. So this can also be ruled out. Not tick, we remembered it as tick spotted. Okay, so tick is spotted, so it is for Indian tick typhus, Rocky Mountain spotted fever, and Mediterranean spotted fever. Okay, so this question is also done. This is how you have to do your PYQs. Now PYQs are your learning tool always. They are not your practicing tool. So what you have to do is you have to learn all the PYQ with all the other options. You have to also know why the other options are not the answers, and which is one is the answer and why, the reason behind all of it. Okay, this is how you have to do your PYQs. Now coming to question 4, rickettsial diseases are differentiated based on now your rickettsial diseases are based on arthropod vectors. Yes, because Rickettsia prowazekii has its vector as Louse. Then tick is for tick typhus and Rocky Mountain and Mediterranean is what I told you. Then flea is for endemic. So yes, different diseases have different vectors there. So yes, they can be differentiated on the basis of this. Then clinical features, yes, in Rocky Mountain spotted fever we saw that the palms and soles are involved. Okay, there are rashes on palms and soles and they start from there, and it is centripetal, which is in contrast to epidemic typhus. Epidemic typhus mein the rash is centrifugal. So yeah, this is a different clinical features. Like scrub typhus is associated with eschar. So yes, they are differentiated on the basis of clinical features also. Now serology, Weil, Felix antigen, yes, we are very sure about that. OXK is for scrub, OX19 is for epidemic, and OX2 is for endemic and Rocky Mountain spotted fever. So yeah, so D would be the answer here, all of them. Okay, then moving to question 5. Which of the following belongs to scrub typhus group? Scrub typhus, S for S, Orientia tsutsugamushi. So yes, C would be the answer here. And the vector is trombiculate mite. More specifically, larval form, which is also known as chiggers. Rickettsia prowazekii causes epidemic typhus. Then Rickettsia, R for R is what I told you, Rocky Mountain spotted fever. Then Coxiella burnetii. Okay, we wrote it as Q. So when we write it as like this is Q fever. This is what causes Q fever. And for Q fever, we remember it as question mark. So no vector. Where is the vector? Question mark. Where is the vector? No vector and no rash. 2 no's are associated with Q fever. Now moving on to 6th question. It is saying that a 22-year-old medical student presents with fever rash starting on the wrist and ankle. I made you remember it like that कि Rocky Mountain spotted fever में Rocky Mountain spotted fever R for R, wrist is how it is pronounced as R, तो ऐसे भी याद रख सकते हैं. Otherwise there is also way to remember it कि first your palms and soles comes in contact with the ground, so yeah, that is also another way. Spreading centripetally, and because of a tick bite, तो रॉकी माउंटेन स्पॉटेड फीवर के लिए एंड मेडिटेरेनियन स्पॉटेड फीवर के लिए बोथ ऑफ द स्पॉटेड वी रिमेंबर्ड इट एज टिक स्पॉटेड, तो यहाँ पे आंसर होगा रॉकी माउंटेन स्पॉटेड फीवर. देन योर 7th क्वेश्चन, अ फार्मर फ्रॉम हिमाचल प्रदेश हैज़ फीवर एस्कार एट द साइट ऑफ बाइट माइट. तो माइट के लिए हमने क्या याद किया था? PSM वॉज आर निमोनिक फॉर माइट, वेयर S फॉर स्क्रब टाइफस एंड R वॉज फॉर पॉक्स. तो यहाँ पे देखते हैं, ठीक है, आगे. नाउ एस्कार इज पैथोगनोमिक फॉर स्क्रब टाइफस, मोस्ट कॉमन विद स्क्रब टाइफस, कैन ऑल्सो हैपन विद अदर डिजीजेस टू, बट इट इज़ मोस्ट कॉमन एंड पैथोगनोमिक फॉर स्क्रब टाइफस. ठीक है, lymphadenopathy, rash, all these are associated with scrub typhus, so the disease here is scrub typhus. Now the prisoner of war, when I told you the history, whenever prisoner of wars comes or a history of jail fever comes, your vector would be louse and the disease would be epidemic typhus. So here the vector is asked, so it would be louse. This is your answer here. Now moving on to the 9th question. A child develops fever with a rash involving palms and soles. So this is what I told you, which is least likely. So Rocky Mountain spotted fever would be definitely ruled out because इसमें तो palms and soles are involved. Okay, इसमें तो palms and soles are involved. It is centripetal. So this would be ruled out. Now secondary syphilis में भी palms and soles are involved. So this is also ruled out. Kawasaki disease में भी palms and soles are ruled out. Now in your measles, the rash starts in the face behind the ears, okay, and then spreads all over to the trunk, but the palms and soles are spared here in measles. Measles spares palms and soles, so this would be the answer here. And moving to 10th question, pneumonia, hepatitis, culture negative, endocarditis. So now the Duke's criteria has been updated. ठीक है, तो ड्यूक्स क्राइटेरिया अपडेट हो चुका है. नेगेटिव व्हील फेलिक्स टेस्ट डेफिनेटली गोज विद क्यू फीवर, क्योंकि हम इसको रूल आउट कर सकते हैं ईजिली कि इसके लिए OXK होता है. इसके लिए फॉर OX19 इट इज़ एपिडेमिक टाइफस, तो यहाँ इसके लिए OX19 होता है, इसके लिए OX2 होता है, ऑल दीज थिंग्स. बट क्यू फीवर में तो नेगेटिव होता है, तो दिस वे तो क्यू फीवर वुड बी द आंसर ओनली. बट कल्चर नेगेटिव एंडोकार्डाइटिस नहीं होता है अकॉर्डिंग टू योर मॉडिफाइड ड्यूक्स क्राइटेरिया. और एटलीस्ट वन कल्चर शुड बी देयर ना, वन पॉजिटिव कल्चर हो सकता है. सो दिस माइट बी an old question, so just let's move on with this. Now question number 11, OXK, I told you earlier, K for K, scrub. You can write scrub as K instead of C. So scrub. Then OX2 positivity is seen in Rocky Mountain spotted fever and endemic typhus. OX19 was for epidemic and OX2 is for Rocky Mountain spotted fever and endemic. Now best diagnostic test for scrub typhus, which is the gold standard, so it is indirect immunofluorescence assay. Indirect immunofluorescence, I'll write it as IFA. Now the most sensitive in early stages could be PCR, also IFA. Now the GMs are stained biopsy showing intracellular cocobacilli in endothelial cells. So it is vasculitis and it is stained by GMs or Wharton study. Now moving on forward, we the drug of choice for rickettsial infections in adults. So the drug of choice for all of them are doxycycline is what we know. So doxycycline for everyone. But for drug of choice in pregnant and children, azithromycin pregnancy में दे सकते हैं. Doxycycline is contraindicated in pregnancy, so azithromycin. Then alternative with doxycycline is contraindicated. The older alternative if it was contraindicated was chloramphenicol. Okay, it was an older alternative. Now which is not used? Now doxycycline is definitely the drug of choice. Then azithromycin is given in pregnancy and children, and then chloramphenicol was the older alternative. So even if you don't know the answer, this is what I was trying to tell earlier also, that we'll use all the data that we have here, but also we'll use the rule out technique. Okay, so by ruling out also this is used. So B would be the answer here. Now Jerisch-Hexheimer reaction occurs in the treatment of all of them, so all would be the answer here. Now rash on Rocky Mountain spotted fever appears first on palms and soles. Rash and typhus fever starts on trunk. It's a centrifugal rash. This is the point that has to be noted, a differentiating point between the two of them. Eschar is classically seen in scrub typhus. That is what I told you earlier. वैसे तो generally it can be seen in any of these, but classically or it is pathognomic of scrub typhus only. Now Brill-Zinsser disease. Okay, Brill-Zinsser disease, I told you the only Rickettsia that has Z's in its spelling is Rickettsia prowazekii. Z for Z. Brill-Zinsser disease causes epidemic typhus. No, it's a mild recrudescence form of epidemic typhus. If the patient is like immunodeficient or anything, then mild recrudescence form, it recurs in the form of Brill-Zinsser disease. Okay, now which is not transmitted by tick? So we remember it as ki Rocky Mountain spotted fever या Mediterranean spotted fever, तो tick is spotted, तो tick, so this is ruled out. Then this epidemic typhus के लिए we know that it is louse, so louse, this definitely cannot be the answer, so D is the answer. बाकी for Rocky Mountain spotted fever, Mediterranean spotted fever, ehrlichiosis and tularemia, for all of these tick is the vector. Then which rickettsial disease does not require an arthropod vector? So we remember this as Q. Q is question mark. So Q के लिए no vector is required. No vector for Q fever. Coxiella burnetii. Okay. Now which organ system is primarily involved in pathogenesis of rickettsial infections? It is endothelium. Vasculitis. Okay, vasculitis is pathognomic. Now Weil-Felix test is based on cross reactivity with the antigens of, so it is Proteus. It cross reacts with Proteus vulgaris OX strains. So Proteus vulgaris OX strains, cross reactivity. Bear with my writing. Okay, Proteus vulgaris. Now which Rickettsia has worldwide distribution and causes Rocky Mountain spotted fever? Yes, Epidemic. Epidemic spreads really fast, so epidemic typhus. And the Rickettsia, this is the disease, and the organism is, positive organism is Rickettsia prowazekii. Now which disease is caused by Rickettsia prowazekii? Epidemic typhus. Same thing again. So these are all the questions that have been asked either or are potential questions for your future exams. So kindly do practice them. These are really very high yield. And definitely like the video, subscribe and share it with your friends if you find it useful, and let me know in the comments below how useful did you find it. Okay, so that was all for today. Thank you and have a nice day. Do subscribe if you like it. Thank you. We'll see you again with another challenging topic, and just we'll try to make it easier for you. Till then, bye bye. Take care.